Human Services Committee, Joanna, please, will you all begin for the Pledge of Allegiance?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Would you please remain standing, please, for a moment of silence in regards to the atrocities of 9/11. Thank you. Before we begin this morning, I would announce the passing of Charles Mazurowski. Charles served as Crown Point Town Supervisor for quite a few years. He first served as a town councilman, and after his years as supervisor, he returned as town councilman until his recent death. And I must say he has been my mentor on a daily basis. Charles was a veteran of World War II. He witnessed the atrocities of the German prison camps. He was one of those veterans who could talk about his experiences with a hope to enlighten mankind to the evils of war. Calling hours will be Wednesday from 4 to 7 at Harlan Funeral Home, with services at Sacred Heart at 12 o'clock on Thursday. Supervisors and county officials who wish to attend should meet at the church parking lot at 11:30. Thank you very much. I would now offer a resolution of condolence for the Mazurowski family.
Second.
All those in favor? Thanks. The Department of Social Services. John is not here today. In his presence is Sue Ann Carey.
Good morning. The Department of Social Services has no report today.
Any questions for Sue Ann? Thank you, Sue.
Thank you.
Mental Health, Steve Ballard.
Good morning. I have a couple of resolutions today. The first is a resolution authorizing the appointment of the following as Director of Community Services designee physicians in accordance with New York State Mental Hygiene Law. That would be little intro there, a little drum roll. That would be Ryan Coates, MD, John Esper, MD, and Mahmoud Hamza, MD.
A resolution to that effect? By Mr. Monte and a second by Mr. Dillon. All those in favor signify by saying aye.
Aye.
Opposed? Carried.
Okay, so the next resolution was something that I didn't have in with the agenda, so I placed a separate sheet on your desk this morning. Before I go to the resolution, I have a report which will make the resolution make more sense, and that is that the Essex County Mental Health Services psychiatrist Dov Rappaport is resigning from his full-time position at the clinic for health reasons, and that will be effective October 3rd, 2016. He has agreed to continue on a part-time basis at least through the end of 2016, while we conduct our search for a full-time replacement. So my resolution is a resolution authorizing the Essex County Purchasing Department to release an RFP for professional recruitment and replacement services for a qualified psychiatrist at Essex County Mental Health Clinic, and to award a contract in accordance with the Essex County Procurement Purchasing Policy, providing that the amount of the contract does not exceed $26,000.
An endorsement of that resolution. Mr. Paludi, a second. Mr. Martin, any questions, concerns in regards to this resolution? All those in favor signify by saying aye.
Aye.
Opposed? Carried.
Thank you. And I'll just add that there will not be an increase in budgeted expenditures for this year. We will use money that we'll be saving from the salary and fringe for the full-time position that will more than offset any amount for that contract. Some of you may remember we were without a psychiatrist for 11 months in 2014, and at that time, toward the end of that, at about month 8, we had an RFP for recruitment, and we were just about ready to award a contract for a recruiting firm when we did get Dr. Rappaport, who was then a telepsychiatrist contract doctor for us at that point. I think that was probably very fortunate bit of luck that we were able to get him for these past almost 2 years. And at that point, I had really resolved that if or when this happened again, and we were without a full-time psychiatrist, that we would just go directly to the recruitment. Hopefully, we can really close that window in terms of filling a full-time position. So thank you very much for the resolution today.
Thank you, Steve. Any other questions for Steve today? Thanks. Public Health, Linda Beers.
Good morning. I would like to start today by asking Jessica actually to come up. This month is Preparedness Month, but I wanted to tell you that the terrorist attacks of September 11th, 2001 uncovered weaknesses in the United States national public health infrastructure. The response to this was efforts to not have the integrated communication and unified command needed for a large-scale response, and information was crucial for decision-making was found to be weakened. Since then, as you're aware, the Public Health Department, as many departments, have received grants for preparedness. We take it very serious. We have a really great rapport with Don Janquish's department and all of our other department heads. We work collaboratively to make our county as strong as possible. Jessica heads up the preparedness department in Essex County. So again, it's National Preparedness Month, so I asked that she could come up and just say a few words about what we're doing in the year ahead and what the scope of preparedness looks like for Essex County. Do I need... She's here. Okay.
I'll just take a couple of minutes. I wanted to let you know about an upcoming exercise that we have going on. It will be an extreme weather event. This is being coordinated across the North Country, Clinton, Essex, Franklin, and Hamilton counties. We're working with our hospital partners, Office of Emergency Management, EMS, and we're looking at focusing on, in Essex County anyway, vulnerable populations and how we can improve our information sharing, emergency operations coordination, and address medical surges. So if we needed to have people leave their homes and enter medical care in some way, that we can do that. So in that regard, we're engaging all the home care agencies, adult care facilities, Office for the Aging, and then entities that serve our youngest citizens also. So that exercise will be a one-week time series that we condensed to a 4-hour time period of the exercise, and we'll probably have that scheduled in January. And then in March, everybody in the North Country will be conducting an infectious disease exercise March 2nd for pandemic flu, and that's another one that we have coming up in the next few months.
Any questions?
Thank you, Jessica. So I do have 3 resolutions. I have one in front of you. I think I'll put that one off to the last. And I'm sorry I didn't make it in time for the report to come out, but I have one to authorize the Public Health Department to accept the WIC grant. This is to accept the monies for year 2 of a 5-year grant that you've already approved. So again, it's to accept year 2 of the 5-year grant for WIC monies that you've already approved. So I'm looking for a resolution.
You're requesting that any further budget amendments are authorized?
Yes.
Okay.
The resolution for that, Mr. Preston, the second. Mr. Manager, further questions or concerns? Being none, all those in favor?
Aye.
Opposed? Carried.
The other resolution I have is we had our PAC, our Professional Advisory Council, and our FAC, Public Health Advisory Council meeting was held on 9/6, and I have a resolution to accept and review the policies and procedures. Mr. Monti, I understand that you had a concern. I can make them available to you, but they only get approved on the day of that, which was 9/6. I also wanted to tell you that we do have a board member on our Professional Advisory Council that represents your board that sits there. Dave Blades is still attending. He was it. Charlie has been on it, but he hasn't been. But I'm happy to make them available to you. So even if you make a resolution now, you have the full board, I guess, to approve it fully. But I don't know how to get it all to you because it's sometimes over 200 and something pages. I could send it into zip file if any of you want to review the policies and procedures approved by the Public Health Advisory Council. They are reviewed by Dr. McKeever, who is our governing medical examiner, and put forth by my staff, reviewed by myself as well. So,
Well, I think number 1, Dave's an ex-board member.
Not
a current board member.
He stayed on it.
And number 2, were those the books that you brought over here that I reviewed?
Yes.
So I've already reviewed those previously.
Correct. So what we
So
do...
you got updates to those books?
Correct. Slight updates.
So that would be the only thing that I would want to review possibly.
Okay.
Be any updates.
Okay. That's 112 pages, and I'm happy to see you in email form.
You can drop them up here and I can look at them. That's fine. Stop there.
Perfect. I'll bring them to the board by the end of the day today. I'll have them on the table. Thank you.
The resolution is presented by Linda Beers and you guys policies. Mr. Manager, a second. Mr. McDowell. Any questions or concerns? All those in favor, signify by saying aye. Aye. Opposed? Carried.
This is the other resolution that I sent all of you an email about. I understand Mr. Gilderland has a potential suggestion to this, but I wanted to bring that I'd like to increase the weekly hours of the public health principal accountant clerk from 37.5 to 40 hours. In 2016, the Public Health Department abolished the fiscal manager position. The job duties were absorbed by the principal accountant clerk and an outside vendor. Our public health, or a public account clerk, principal accountant clerk, her primary role before that was the certified home health agency. That's what she did, completely the CHA. When we abolished that position, she also picked up oversight of the prevention, the WIC, the early intervention and preschool services. There is an outside vendor, but he needs to get all the data processed. Also, Dory's helping me do all the budgets, which the outside vendor doesn't do. So this 2.5 hours a week equates to, till the end of the year, to $502. I have the money in my budget, but moving forward in 2017, it would be 2.5 hours times the weeks times her rate of pay forward. I figured it out to be roughly $2,900 increase. Dory has done an amazing job. I think we've done it successfully. We've accomplished what we set out to do, but we're running short of hours to finish all the extra tasks. So that's where I'm headed, the 2.5 hours, and again, that makes up a full-time position that we were able to not have.
Motion to allow this on the floor. Mr. President, second. Mr. McDonald, questions and concerns in regards to this, or Mr. Gilman?
We are, the salary management subcommittee are dealing with hours issues of other departments. I would request, in order to not have
That's fine with me. I didn't, I was advised that's just, whatever. I'm fine to do that. I'll get with you after today and talk to you how to do that.
Any other questions? Yes, Mr. Monty.
I like Sean's idea, and also the fact that, you know, we are in September, you know, I think it's good to have a beautiful and plan for it for next year, you know, not saying it isn't, you know, something she deserves for doing extra work, exactly, but I think, you know, in September, given that time, we can look at it better and make a better judgment on it.
Okay. I'm happy to do that.
All those in favor? Withdraw the resolution.
Okay. I withdraw the resolution to go through the orders.
Mr. Preston and Mr. McNally, do you agree to withdraw the resolution?
Yes.
resolution withdrawn.
The resolution is hereby withdrawn. Any other concerns for Linda? Chrissy Lurkey, Office for the Aging.
Good morning. I have no resolutions. I just have a couple of quick updates. As many of you know, we are at the Office of Aging, the ultimate certifier for through DSS. So that means that we process all the HEAP applications for the individuals that are 60 and over that do not have SNAP, also known as food stamp benefits. So we were fortunate to see our first set of applications come in early last week. We have almost 150 in office right now, so the staff are super excited. It's a busy time, but they really enjoy this time of year. So just updates for household income, it changes usually each year. So one person is $2,300, two-person household is $3,007, three-person $4,715, and four-person $4,423. And it usually increases about $600 for each additional person in the household. Those that received HEAP last year will receive an early mail-out. That's what we're receiving now. And any individual that did not apply and receive HEAP benefits in Essex County last year can apply once HEAP opens, which is November 14th. Benefits stay the same. That will range between $575 and $625. The next, just a quick update, and I know Mr. Monty may want to chime in on this as well as Mr. Tyler. We sit on the Essex County Task Force Against Domestic Violence, and October is Domestic Violence Awareness Month. So each year, this task force holds a very wonderful event, normally the first Tuesday of the month in October out here on the lawn. So that is scheduled for October 4th from 11:30 to 12:30. We always have the Osceola Valley Choir come down and sing. The color guard is there to represent it. Typically they have the Clothesline Project, which, if no one's aware, that is a t-shirt display of individuals that have been impacted by domestic violence, whether they are a victim themselves, maybe a child of a victim, a family member. And that is able to display their feelings, their emotions of what they actually endured during that domestic violence act. So it's really moving. It really hits home when you look at those t-shirts. So if anybody is interested, we would love to have as many faces there as we can. And that's my update. Any questions?
Mr. Monty.
I definitely would like to encourage the board, to go that day. Domestic violence is a very serious issue that affects everyone in one way or another. And since I've been sitting on that task force, I actually sat on it previously, but in the last year, I guess depends on how you look at it, a good or bad scenario. The contacts for domestic violence have increased, which tells me we're getting the information out. The people are hearing about it and finding the courage to step forward and seek help. And that's a credit to Nikki and Chrissy and all that group that are out there every day getting this information out. And I think it would be a nice gesture for the board to be there. Thank you.
I put on in your boxes the merger report for aging and public health. Just so you're aware, I mean, obviously I just put it on your desk, so I'm not expecting anything to occur today, but I just wanted you to be aware. We completed that report with Chrissy and Linda's help. I sent copies to the Aging Advisory Council, hard copies in the mail. I'm not sure if they've got them yet. I sent an electronic copy to the director of the Aging Advisory Council. I sent a hard copy to New York State Director of Aging, Mr. Owens. So we also had 175 copies made up of this report. Chrissy and Linda will be starting the education process, so to speak, and bringing it to our nutrition groups and our seniors throughout the county. We want to get copies of it out so that people understand what it is that we're trying to accomplish and what the overall plan is. This is part of the last step of the overall approval process that's required. The final step is for New York State Office of the Aging to approve this after we have a public hearing. This is not the public hearing. 30 days from now, or 30 days or so, I'm not sure, after we've completed the education process, we will hold a public hearing and allow any public input as it relates to this, and then we will submit to the New York State Office for the Aging for final approval. But that's where we are now, and if you have any questions on the report, just give me a call, or Chrissy or Linda.
Thanks for that. Yes, Mr. Monty.
Dan, on that packet you sent out, there was also a poster of 4 nutrition sites. Are they the only 4 that you're going to, or is it going to all the nutrition sites? Go ahead.
Yep. That flyer actually went out to every single nutrition site, and it also actually went out to every single home delivered meal person. So even though there's only 4 at this time scheduled, every person that is in receipt of any type of service through our nutrition program have received that.
Okay, but those are the only 4 places that you're going to go and educate people?
At this time, that's what we have scheduled. Linda and I looked at our schedule, and every day that we had open, that's where we have somebody scheduled right now. And then we will look forward into October if date necessary.
Yeah. Thank you.
Any other concerns for Chrissy? Yes, Mr. Therapy.
Chrissy, can you forward us the guidelines for the HEAP program this year? The income guidelines? Thanks.
Mr. Monty?
I want to thank Chrissy for the summer picnic that you and the nutrition program put on for the seniors in Lewis here a few weeks ago. It was phenomenal. I'm still hearing people talking about it. You guys did a great job, and thank you. It was much appreciated.
Thank you. We actually, as you may know, a couple of years ago, we stopped hosting the Newcomb picnic because it was very, very expensive for the office. So in turn, we started to do the regional picnics, and we're getting a ton of great feedback. Todd was very well attended. Mariah last week was well attended. Worcester's coming up. Wilmington, even though it had a gloomy day, they have a beautiful site up there, and that was well attended. So our staff, nutrition, and the folks that come, they really, really do enjoy it. So thank you all that.
Other comments or concerns for Office of the Aging? Thanks, Chrissy.
Thank you.
Moving on to transportation. Nancy Dugal is not here today, but she did present us with two resolutions. Dan, if you would introduce those, please.
Yeah, we need one resolution authorizing the acceptance of additional grant funding in the amount of $32,189. This is additional money from the state to be used. It has to be used on a capital project with at least a 10-year useful life. What we intend is to combine this with the $42,000 or so that they, or the $40,000 or so that they gave you, they gave us last month. This will make a total of $73,423 for the design and construction of that pole barn that we had talked about last year in the budget process. So essentially, this will pay for most of the construction of that pole barn. I don't anticipate that it would go over that. So we need that resolution to accept the grant, and then we would need a second resolution authorizing the appropriate budget transfers for that grant funding.
A resolution involving, a motion involving the first resolution in regards to the pole barn. Mr. Gilliland, and the second by Mr. McDowell. Any further questions or concerns in regards to this? There being none, all those in favor signify by saying aye. Aye. Opposed? Carried. A resolution involving the appropriation for this. Mr. Gilliland, thank you. A second? Mr. Monte. Questions or concerns in regards to this? All those in favor signify by saying aye. Aye. Opposed? Carried. Any other issues to come before the Human Services Committee today? Yes, Mr. Marion.
To increase funding for the...
Oh, yeah, you're right. Yeah, you're correct. Yeah. So this is sale of surplus vehicles. We sold a couple, or a bus or so on the website for, so we have a total of $7,575 in surplus revenue that will go into her reserve account for spending back on the purchase of buses.
A resolution involving this budget amendment. It's found on the front page of your agenda, Human Services. Mr. Khalidi. A second, please. Mr. Gilliland, thank you. You're so awake today. Any questions or concerns in regards to this? All those in favor signify by saying aye. Aye. Opposed? Carried. There being no further issues in regards to the Human Services Committee, we are adjourned.